Hello, everybody. My name is Michelle Jones, and I am so honored to welcome you to today's workshop where we get to talk about sleep. And joining us today, we have Dr. Valerie Cacho. Hi, Dr.
Hello.
Cacho. Dr. Val, it's good to have you with us today, and we're so glad that you're taking the time to help us learn more about sleep. Before we get started, I want to do a couple little announcements. I see most of you have found the chat, and I'm going to say hello to all of you again. And we do have Amy. She is handling the chat up throughout the workshop. She will mark them as questions, and at the end of the chat, we will go through and Dr. Cacho will try to address as many of those as possible. We are on a limited time. We're trying to keep this to an hour just to respect everybody's time. So again, if you have questions that pop up during the workshop, please ask them in the chat. We will address them at the end of the workshop. So I do want to give you a short introduction to Dr. Val. I actually went to high school with her. And so it's so neat to connect with you again after all of these years and have you with us. After high school, Dr. Cacho attended Loma Linda University, and she is trained and practices as a sleep specialist. She has also completed a fellowship in integrative medicine, and she has co-edited the book titled Integrative Sleep Medicine, and that's a part of the Wheel Integrative Medicine series. So we're so excited to have you here with us today, Dr. Cacho. Go ahead and tell us more about sleep.
Thanks so much, Michelle, for inviting me here. And thank you, everybody, for signing up. I know that everyone has really busy lives and busy days. So I really invite you and thank you for taking the time to really focus on your health and learn a little bit more about sleep. So the title for today's talk is called Sleep Essentials, Expert Sleep Tips for Better Health. Let's get started. Alrighty. So thank you so much again, Michelle, for that wonderful introduction. Just a little bit more about me. Yes, I'm a sleep doctor. I also do some wellness consulting. I'm actually fellowship trained in sleep medicine. It's in a year fellowship. That's after my residency, which was internal medicine. And then I actually learned more about integrative medicine, which I like to think of all the things you don't learn about in med school that can be applicable for a person's health and healing. I have my own clinical practice for residents of Hawaii and California called Sleep Life Med, and I'm creating an online educational program called Sleephoria for women. I have 2 kids under 5, so I know what it's like to not get enough sleep sometimes, and I definitely consider myself a teacher. I love talking about sleep, and I'm a perpetual student. I always learn from my patients, from those in the community when I give talks, and I continue to read a lot of journals as well. So let's dive in. This is just a disclaimer. Even though I am a physician in this role, I am just an educator, I'm a teacher. So this is all just educational purposes. And if you do have any specific medical concerns, please talk to your healthcare professional about them. So this is a roadmap for what we'll be discussing today. I'll start off talking about Sleep 101, some basics about sleep science. Then we'll talk specifically about sleep and metabolism as something really probably that's on your minds, and how what things you learned about in full plate living, and how your diet and sleep can interact. And we'll talk a little bit about specific sleep disorders, things that I see in my clinic, and we'll talk about treating these disorders, and then do a little self-check in and see how what I've discussed today can relate to your life. Alrighty, so Sleep 101, why do we sleep? Then I'll talk about our sleep physiology, and then something called the phase response curve. So this is one of my favorite quotes. It's the simplest way to drastically improve your life is to get more sleep, right? And this is from Tim Herrera, writer of the New York Times. And he says, imagine this, someone walks up to you and pitches you on a brand new magical pill. This pill can measurably improve your memory, your overall cognitive performance, your ability to learn new information, have better receptivity to facial cues, mood, handle more problems, improve your metabolism, your risk for heart disease and immune system. Would you take that pill? And guess what? You can by getting more sleep. So some of the nitty gritty of why we sleep, it's really good for our memories. Our brains actually have this system called the lymphatic system, where throughout the day there's toxins that build up, and at night it gets cleaned out. Sleep is really good for helping us learn and make logical decisions. Cleans up our brain from waste. That's what I talked about, our lymphatic system. Balances our hormones. We'll talk a little bit about hormones today, specifically hormones of appetite and satiety, feeling hungry and feeling full. Also, sleep is really good for strengthening our immune system. When I did primary care and patients would come in, with coughs and colds, I let them know, maybe it's your body telling you that you're not getting enough sleep, and maybe it's just time to rest and slow down. Sleep is really vital for health and wellness, and we'll talk about why in the slides that follow. So jumping right into sleep physiology, what's going on in your brain when you sleep? So if I brought you to my sleep lab and I hooked you up to the EEG, and that stands for electroencephalography, what we're looking for are characteristic patterns of how fast or how slow your brain waves are going. And they're divided into 4 stages of sleep. You can see here on the left that are squiggly lines. If the squiggly lines are going really fast, it means that you're awake, right? When your brain's awake, your cells are firing, your neurons are firing, the brain cells, and that's a pattern of being awake. There's multiple different neurotransmitters that are involved. GABA specifically, adenosine can help us sleep, but I won't go into those details today and bore you. Really what happens when we sleep, our brain waves slow down, our muscles start to relax, and we lose consciousness. Stage 1, stage 2 is considered light sleep. Stage 3 is deep sleep, also known as slow wave sleep. And then we go into REM, is when our bodies are paralyzed, so we don't act out our dreams, but we can actually dream through the other different stages. As we get older, our sleep does change. We actually have less deep sleep and less REM sleep, and that's from a whole host of multiple reasons. Alrighty, how many hours of sleep do adults need? You can go ahead and put in the chat here, maybe how much you think you need or how much research shows that you need. So I'll give you just a couple seconds to see. Alrighty. Well, 7 to 9, 8, 7 to 8, 6 to 8, 6, quality and quantity. So according to maybe the American Academy of Sleep Medicine, National Sleep Foundation, actually it is 7 to 9. 5 to 7, interesting, but we'll talk about, maybe the pros and cons. Sometimes actually sleeping too much is a concern, as well as undersleeping. What percentage of US adults are sleeping enough? What do you think about that? How many of us are getting an adequate amount of sleep according to the 7 to 9? 25%, 30%? Oh, sort of lower numbers than I thought. So actually this week, the CDC put out new data, and it's about 28% are not getting enough sleep. So, the question was how many are getting adequate amount of sleep? So in the 70s. Yeah, so about a third of us aren't sleeping enough. And if you can look at the breakdown, age plays a role, right? As the older than 65 generation, maybe in retirement, we're catching up from sleep that we've lost when we had young kids and we were working pretty regularly. The phase response curve. So within our body, there's 2 natural rhythms or biorhythms that control our sleep and wake. This is one of my favorite slides to teach my patients about. It's a little bit busy, but it makes a lot of sense as I walk you through it. So let's start with the top one. It's called the sleep drive, or the homeostatic regulation of sleep. So let's say you got the recommended amount of sleep between 7 to 9. There is a wide range. For me, probably 8, 8.5, 9 is when I actually do feel good. When I wake up in the morning, generally I'm not tired, I'm refreshed, and I'm ready to start my day. And that's because, it takes, at night, I've replenished my sleep drive and it has to build up. So the sleep drive, actually, there's a protein that we can measure. It's called adenosine, or process S, and it builds up as the day goes along. So the longer we're awake, the sleepier we get. Just like, I have this cup of water here. As the day goes on, right, that water level is filling up, and then gets to a certain level, and I get so sleepy, we get so sleepy, and then we go to sleep. For most people, maybe our bedtime is around 9 to 11. As we sleep, that level goes down. Minimum amount of core sleep time is about 5 hours. And so if you hear a noise about 5 hours in, or maybe your bed partner snoring, a dog barks, you wake up, it may be hard for you to go back to sleep. Why is that? Because you're not as sleepy 5 hours in as when you fell asleep. Just like your phone battery, right? If your phone is charged about 50, 60%, you can function, right? You can, text, maybe check the news, go on a couple websites, but not as optimized as if at 90 to 100%. So that's the homeostatic regulation or sleep. The longer you're awake, the sleepier you get. Exercise plays a role with this, right? Exercise, we break down ATP, which is a protein of energy. And that actually makes us more sleepy, right? Because that is part of adenosine. So exercise is really good for sleep. The other part of our biorhythm is called the circadian alerting signal, or our circadian rhythm, or our internal clock. And that's based on light, darkness, and melatonin. So when it's light, hopefully your bed is in a situation where you can get natural sunlight hitting your eyeballs, your retina, and that wakes you up. The sun tells our bodies it's time to be awake, it's time to be alert. As the day goes on, right, suddenly, the evening comes, we have less light, and our body's getting ready to go to bed. So when it's dark, it releases this hormone called melatonin deep inside our brain in a gland called the pineal gland. And think of melatonin like the person that starts the race. Sometimes people take melatonin over the counter as a sleeping pill, but it's not really a sleeping pill. It's good for shift work or jet lag if you're traveling between different time zones, but it really just helps regulate the timing of sleep, not necessarily puts us to sleep. And melatonin starts to peak, right, as our sleep drive flattens out. So it helps keep us asleep. And then guess what? When it's light, melatonin says, okay, you don't need me anymore. And then your body starts to wake up. So that's the circadian rhythm of sleep based on light, darkness, and melatonin. What we have now is technology, right? Technology, lights, technology in our faces. We're on our screens, we're on our phones, if we're watching shows before bedtime, and we have that bright light hitting our brains, hitting our retinas. Guess what? It can delay our sleep time because it's affecting the system. Melatonin says, oh, wait, it's still bright. I don't need to go to sleep. And so if you have a hard time falling asleep or you have a difficulty time staying asleep, think about that light exposure, light pollution, not just from our phones, maybe if we're outside, if we're going out, living in a city. Sometimes my patients who don't have curtains and they live near a bright street lamp, that light can affect their ability to sleep at night. So avoid light an hour prior to your bedtime and make sure that you're getting enough adequate sunlight in the morning time. And that really can help regulate your sleep. So yeah, centers for sleep deprivation include screens. Little sleep, big costs. So this was a campaign through the American Sleep Foundation. And what I really want to highlight here is the warning signs that you need more sleep. Sometimes people don't know that they need more sleep because it's been going on for quite some time. If you feel like you're starting to fall asleep when driving, especially in traffic or at a red light, that could be a sign. You feel like you're forgetful or making some mistakes, having some brain fog, that can be a sign of not getting enough sleep. You're feeling tired, fatigued, lacking energy, and needing to take a nap. Most adults, I would say, don't need to take a nap, especially after kindergarten. So if you are needing to nap, that could be a sign you're not getting enough sleep or having underlying sleep condition. With that said, I am a big proponent of naps. So if you have the opportunity to nap and it's safe to do so, I would strongly encourage a nap over having to get more caffeine, because caffeine can actually affect your sleep. It takes a while for us to break down caffeine out of our bodies. I think we're overly caffeinated in and of itself. So if you can nap, in the afternoon instead of having another cup of coffee, I do recommend that. You are irritable, grouchy, lose your temper easily. So if you don't get enough sleep, something we learned in Sleep Fellowship is mood is one of the first things to go. So maybe you don't notice it, but maybe your family members or coworkers will start to notice. Think about what's going on with your sleep. And then the last is you rely on caffeine to get through the day. Yeah, think about your need for caffeine. If you like the taste, that's one thing. But if you feel like you are dependent on it, needing to have more than 2, 3, 4 cups. If you have a whole pot, you need to make another one. Those are some cues to think about. Maybe take a look at what's going on with your sleep quality and your sleep quantity. So sleep and cognition. So what cognition means is just how we think, how we reason, how we make decisions, our memory centers, and our language is all rolled up into our cognitive system. our attention gets worse when we're sleep deprived. And this is something that can affect all ages. And it's dose dependent. So the more sleep loss we have, the worse our attention actually is. It takes us longer to do things. And caffeine can help with this, but it's not necessarily the cure, right? Getting better sleep is the cure. Memory, it can be degraded by sleep deprivation, so not getting enough sleep. We can recall incorrect information. So maybe something if you're going for jury duty and make sure you're getting enough sleep, or actually something who's going on the witness stand, you know, did they get enough sleep? Are they answering the questions appropriately? Or, you know, sometimes your mind can play some tricks on you if you're not sleeping well. Yeah, so that is very important. So if you actually do get better sleep, you can do better on memory tests. So I don't know if any of you are students or if you're parents of any students. One of my biggest recommendations is do not pull an all-nighter. Something that I did not learn about when I was going through medical school. I remember pulling all-nighters and then I'd fall asleep during some of my tests. So some information that's really handy. Actually get more sleep, you'll do better on your test than trying to cram extra information to your brain. Sleep and the heart go hand in hand. When we don't get enough sleep, it's really stressful for the body. It's inflammatory for the body. And we have more adrenaline. And that adrenaline can increase that system that raises our blood pressure. So we have a higher rate of high blood pressure. HTN is hypertension or high blood pressure. And this is actually seen more often in women. Sleeping longer may improve the blood pressure. Does this mean that if I get, 8 hours of sleep, doc, I won't need to take my medication? Well, we don't have that data, but it is good to make sure that you're getting an adequate amount of sleep. And also, right, if you don't want to have a heart attack, sleep longer as well, right? It's protective for the heart to be able to rest it at night. This was pretty interesting. More calcification of the coronary arteries in people who don't sleep enough. So calcification of the coronary arteries, if you think of this as your heart, there's blood vessels that supply oxygen to the heart on the outside. And if you don't get enough sleep, those blood vessels actually harden, and we can see changes in that. And so, because of this also, there's higher morbidity and more mortality. People are sicker and die faster if you don't get enough sleep. So, hopefully with this information, that sleep is really vital for self-preservation and longevity. It's anti-aging, and also it's free. So let's move on to sleep and metabolism. What are hormones? Hormones are simply messengers in our body, right? That can go from our brain to different organs. And I have a picture here of our liver and our pancreas, because we'll be talking about glucose and insulin. Hormones of sleep, these are a few that I've listed here: growth hormone, ghrelin and leptin, insulin and cortisol, aldosterone, antidiuretic hormone, melatonin. And this is the short list, but really for the purposes of our talk today, I'll be discussing these three. Ghrelin and leptin. So ghrelin, I like to think of as, I create these little mnemonics to help me remember things. Ghrelin, think of like a gremlin. Ghrelin is released from the stomach, and it triggers our appetite. So levels start to increase if we're fasting, right? The longer we go without eating, we get hungry, and also levels can increase at night. So gremlin makes you want to eat more. Leptin sort of puts the brake on our appetite, makes us feel full. It's actually released from our white fat cells, and it's associated with decreasing our appetite. Interestingly enough, the levels increase after eating, but also at night. And when we don't sleep enough, we sleep deprive ourselves. They've actually done studies where they slept deprived college kids, and then they see what happens. There's less leptin, more ghrelin, and so more appetite. And guess what? Their appetite for the type of foods that they want to eat is the simple carbohydrates, the low fiber foods, the high sugar foods, because that's sort of the quick fuel. And that's what they're craving when they're not getting enough sleep, because your body perceives, well, if I'm awake, then I need more fuel. Growth hormone. So growth hormone is good for growth. It's good for our muscles. It's good for our bones, and also can help regulate some of our metabolism. So as we, have more sleep, especially the slow wave sleep, the deep sleep, levels of growth hormone increase. So for parents, if you have young kids, sleep is not only good for their memory, focus, and attention, but also for growing and development. There's lower levels in people who sleep deprive themselves or have underlying sleep conditions that aren't treated. And growth hormone can play a role in lowering insulin levels when we fall asleep. So moving on to insulin and cortisol. So insulin is a hormone that lowers our blood sugar in the peripheries, helps move sugar into the muscles, and also is part of stimulating our appetite. Cortisol, sometimes it's known as the stress hormone, and our levels actually rise when we wake up, right? Because, if we've gone 7, 8, 9 hours without eating, right, we want to have more cortisol to help stimulate us to wake up, to help release some of that sugar. And also cortisol can impair insulin sensitivity. So we have too much cortisol around from not sleeping, from chronic stress. It can lead to problems with us being able to adequately handle our blood sugar. So, right, going back to sleep deprivation, it's associated with more cortisol around, more growth hormone around, and that can lead to some insulin resistance, which can lead to diabetes. So sleep deprivation and diabetes, there's this 3-part theory where we're more hungry, right? We don't get enough sleep, we're more hungry. We're not expending enough energy, so we can tend to gain weight, and it causes changes in our glucose metabolism. So we're not, basically processing it as well as we could be or should be. And the biggest part of this is, you have a potential to double your risk of getting diabetes if you're not sleeping enough, right? So if you're on the border, if you're pre-diabetes, or if you have diabetes, I would encourage you to take a look at your sleep. There's only so many medications around that can help lower blood sugar. Diet is also really important. But guess what? You also have this tool, this magical pill of sleep that's free and accessible to you. So consider what's going on with your sleep. Moving on, metabolic syndrome. So aside from higher rates of diabetes, we have an increased risk for metabolic syndrome, which is obesity, elevated triglycerides, elevated blood pressure, and also elevated sugar levels. Obesity is increased if you don't get, at least 5 hours of sleep at night. And, these are just varying studies. But luckily, if you do add more sleep, you can decrease your BMI by about 1/3. And it's the same risk for kids as adults. Yeah, so kids should be encouraged to sleep. The requirement for pediatric sleep is dependent by age. Sleep deprivation leads to less leptin, as I talked about. Leptin puts the brakes on your appetite, makes you feel full, so you get more hungry. So long story short, not sleeping well increases your weight, gives you derangements in your hormone levels that support your metabolism and can lead to things like glucose intolerance and diabetes. Alrighty, so just a little interactive part here. Which evening snack leads to better sleep? So on my screen here, I've got some milk and cookies, and then the other picture here looks really good. A lot of vibrant foods, berries. As we know, we have high fiber. We've got kiwi, and I think that's some granola. So what do you think? Is the milk and cookies leading to better sleep, or the fiber? All right, increased fiber, milk and cookies, fruit, fiber, neither. Interesting, none. Well, let's see. Actually, it's fiber. So I think it's on the next slide, but I just have this little slide here that talks about kiwis. So I don't know if you know this research or if you've heard about it. I've seen it on social media and in some places on some videos on YouTube. This actually was a study in China where they looked at kiwi fruit. So the effect of kiwi fruit consumption on sleep quality in adults with sleep problems. So if you eat 2 kiwis an hour before your bed for 4 weeks, so this is how long the study was, people fell asleep faster. They also slept longer, and their quality of sleep was improved. So it's really important. And when I looked at the sort of the nitty-gritties, it was actually significant. I think people fell asleep about 30 minutes faster, and maybe stayed asleep up to like an hour longer. Yeah, so it's remarkable, because what's the side effect of a kiwi fruit versus taking the sleeping pill, right? Sleeping pills can affect our memory. If we're elderly, we take a sleeping pill, we wake up to have to go to the bathroom, we're a little bit groggy, we can fall and break our hip. Sleeping pills are also associated with memory impairment and potentially even dementia. Yeah, so consider dietary changes that can be helpful. So sleep and nutrition, this is one study. Diets high in fiber were associated with more deep sleep, or slow wave sleep, right? And that's the part of the sleep that our growth hormone goes up to, and less light sleep. And then diets with less fiber, there is more and more saturated fats, right? We're associated with people waking up more at night and having less sleep, deep sleep. So, right, cookies probably have more saturated fat. If you're putting butter in it, they taste good, but it can actually disrupt your sleep. Yeah, high fatty foods, high sugar foods really can cause those insulin spikes, and it's not good for our sleep. So fiber, something that's very in line with the philosophy of full plate living. There's a question, was this sponsored by the Kiwi Growers Association? No, actually, it was a study out of China, I think at a university. So, alrighty, now going on to sleep disorders, sort of what I see on a day-to-day basis. These are probably the four most common: obstructive sleep apnea, insomnia, restless leg syndrome, and narcolepsy. I won't be talking too much about restless leg syndrome or narcolepsy, but just know restless leg syndrome is an urge to move your legs that happens before you fall asleep, and it can lead to problems falling asleep. Can run in the family, and it's associated with low iron. Narcolepsy is a condition usually that occurs in teens, 20s, and 30s, and it's where people are sleepy all the time, regardless of the amount of sleep that they get at night. And it has to do with either genetics or an immune issue. But let's really talk about obstructive sleep apnea, because it's a very common condition and it's often not diagnosed. Very, very common. 1 in 5 adults have at least mild sleep apnea. And what mild means is that after you do a sleep study, we're looking at how many times an hour your airway narrows or closes. So if you can look at this picture here on the side here, the blue arrow that goes in through the nose, back through down of the throat, is the air going into our body. What snoring is snoring means partial collapse of the airway. So at night when you sleep, right, your muscles relax. Sometimes it can relax a little bit too much where the tongue can fall back and close off that airway, and it can make a noise, just like whistling, right? Snoring actually has been associated with things like high blood pressure. So if you don't remember everything today, aside from eating more fiber, it's good for your sleep, snoring is not normal. It could be a sign for potentially concerning conditions such as obstructive sleep apnea. What obstructive sleep apnea represents is the airways more completely collapse. Air has a hard time going through. It can also lead to lower levels of oxygen. Oxygen is really important because all our cells in our body need oxygen, especially our brains and our heart. And that's why, people who have undiagnosed and treated obstructive sleep apnea can have a higher risk for cardiovascular complications, heart attacks, and strokes. The thing about obstructive sleep apnea or OSA, it's really not commonly discussed. Some of the research shows only about 12% of patients start talking about their sleep and sleep apnea with their physician. Only about a third of physicians talk about sleep with their patients, right? We're really busy talking about colonoscopies, pap smears, what else? Talking about your blood sugars, talking about your high blood pressure. Sleep sort of falls down to the wayside. So if you snore, if you're feeling tired, talk to your doctor about it. What are the physical signs of having sleep apnea? Well, people who have small chins or small jaws, right? That just means your airway is a little bit smaller to begin with. If you have a large tongue, how do you know if you have a large tongue? Well, stick out your tongue, and if you can see the scalloping of, basically the imprint of your teeth on the side, it means your tongue's a little bit large. Sometimes people have large tonsils. Generally, this is the case for kids. Deviated nasal septum, right? If you close off one nose, breathe in, have a hard time breathing in and out, that can play a role. And then neck size. So BMI is important, but I think what's more important is if your neck size is above 16 inches for women and above 17 inches for men, right? Because if you have that extra fat pushing down on your airway, it can cause more collapse. Mallampati score is also important. How close are the walls together, right? If you start with a big hole, size 1 or size 2, less likely to have sleep apnea versus if it's 3 or 4, more likely to close off your airway. Signs and symptoms. So apnea means no breathing, cessation of airflow. Snoring, highlighted here in red, it's not normal, it's very common. But if you snore and already have high blood pressure, or already have had a heart attack or stroke, please talk to your doctor about it. Choking or gasping. So what happens is your airway narrows or closes and your brain says, hey, you got to wake up and breathe. So you can wake up choking or gasping. Difficulty maintaining sleep. Unrefreshed sleep, waking up tired because your brain isn't rested. You can feel tired during the day. You can have headaches. You can have problems with memory, concentration, and also waking up to urinate multiple times at night. That's really important. It's not always discussed with patients. What happens is if there's a narrowing here, your lungs actually have to expand more. You take deeper breaths to open up the airway here. Your lungs and your heart are in the same cavity. More pressure on your lungs puts more pressure on your heart. Your heart will stretch and signal down to your kidneys to tell you to wake up and urinate. Yeah, so I've had men and women who have untreated sleep apnea have difficulty with urinating almost every hour. Once we got them tested, diagnosed, and treated, then they did much better. Certainly, it can be a prostate issue, but if your stream is steady and full, look into having your potentially sleep apnea. Take a look at that. Health consequences of untreated sleep apnea, right? If there's no oxygen flowing down, increased risk for high blood pressure, heart failure, irregular heartbeat, stroke, diabetes, right, from getting disrupted sleep. We talked about the derangements in the hormones of metabolism and depression, right? When you don't get enough sleep, you have no energy. When you have no energy, you're feeling down, your mood is definitely affected. Testing for sleep apnea, there's two ways. You can sleep in the comfort of your own home, which most insurance companies prefer. It's a fraction of the cost, and it's great because it's the real world environment. And then you could also sleep in the lab. That's called a polysomnography. All right, this is just a slide as we transition over to insomnia. What is insomnia? It's pretty common. About a third of adults can have it at any given time. It's difficulty falling asleep, staying asleep, or waking up too early in the morning, and has associated daytime symptoms, which can be similar to those of sleep apnea. When you don't sleep long enough, you just don't feel good. Chronic insomnia is more than 3 months. Also, insomnia associated with anxiety and depression. There's a bi-directional relationship to people who have a hard time sleeping and mood disturbances. If you don't sleep well, then you have no energy. You can be more anxious. Sometimes people have anxiety just around not being able to fall asleep. And then when you don't sleep, it creates more anxiety, and it's a feedback loop. Insomnia has been associated with work-related issues and car accidents, right? You're not focused. Maybe it takes longer for you to do a task. And also decreased quality of life is associated with insomnia. Alrighty, so let's now talk about treatment for sleep apnea and insomnia. One of my favorite things to talk about is the waving arm person, right? So this usually is by car dealerships, and that just represents what's going on with our airway here. At the base of this balloon is an air compressor, and that's all basically we use to treat sleep apnea with a continuous positive airway pressure machine. You wear a mask on your face that's connected to a hose connected to this machine that just opens up the airway, pushes the tongue back, pushes air through to keep your airway nice and open. Weight loss is always a good treatment option as well, especially if your neck size is above 16 inches for women, 17 inches for men, and then sleeping on your side, right? On your back is the worst position for sleep apnea because gravity is pulling it down. Your side is less, and definitely your stomach is even less when you're pulled because your tongue is pulled forward, but it can really affect your side. Additional treatment options are head of bed elevation, so getting a fancy bed that props up, raising your torso. You really want to avoid keeping your neck flexed down because that can actually close off your airway. A mandibular advancement device, and that's a mouthpiece here. And what that does, it moves the lower jaw forward, gives you more space in the back of your throat. And then there's also different types of surgeries, removing the tonsils, base of tongue reduction. Some people have part of their tongue cut off, the part that we can't see here, and soft palate reduction, removing the uvula here and the extra soft tissue that can block the airway. Treatment for insomnia. It's really behavioral. Cognitive behavioral therapy is recommended if it's chronic, like if it's lasting more than 3 months. Sleeping pills can help, but just like pain pills, we don't want to be on them for too long. They don't really treat the underlying cause, so they should only be used for about a month or less. What cognitive behavioral therapy does, it walks you through the science of sleep. There's things called stimulus control, where you're using your bed just for sleep restriction. You're trying to limit the amount of time you're in bed just to make sure you're consolidating it and use it only for sleep. It walks you through different lifestyle factors that I'll talk about as well, avoiding caffeine, making sure you're exercising. Some people have a hard time relaxing. We tend to be on autopilot, where we sort of go from one event, one meeting, one thing to the next. And by the time it's dark and it's quiet, our brain is really active because it's processing all the things that we've done throughout the day. And then cognitive restructuring. It takes some of the thoughts that we have about sleep. Sometimes patients come and tell me, I'm a bad sleeper. I've never been good at sleeping well. And those are sort of self-fulfilling prophecies. If you really think you're a bad sleeper, guess what? you're telling your brain that you're a bad sleeper. So as you work with a cognitive behavioral therapist, some doctors do it, some sleep psychologists can help as well, you examine some of those thoughts and helps shift them toward better thoughts that can help you fall asleep. There's also other treatment options, mindfulness-based stress reduction, mindfulness-based therapy for insomnia, clinical hypnotherapy, acupuncture. They've all had research to support their use to help someone sleep better at night. And now we'll talk about, the tips. So sort of, what we're here for, the expert sleep tips. So sleep hygiene just means our sleep habits. And what we do during the day actually affects how we sleep at night. Are we going on walks? Are we, working in front of our computers a lot? What's our exposure to sunlight? Are we using our bed as our desk or as our lounge area? Or are we drinking a lot of coffee, a lot of caffeine? Because that can certainly play a role. So what are the sleep tips? Well, use your bed only for sleep and intercourse and for sex, right? Make sure your bedroom should be your sleep sanctuary. It should be a place of relaxation. Keep your room comfortable and cool as much as possible, right? At night when we sleep, our metabolism really slows down. So if it's too hot, then the cells are going to keep moving and it's hard to relax and fall asleep. I actually have less insomnia patients that come through the wintertime than in the summertime. I used to practice in Hawaii and I actually still practice there, but some people don't have air conditioning. And so during the summer months, they have more difficulty sleeping. Limit exposure to bright light in the evening. And this has to do with our circadian rhythm. So if at all possible, an hour prior before your bedtime, avoid light. Avoid eating a large meal before bedtime. If you are hungry at night, try to eat something light, something healthy, high fiber, avoid the saturated fats. Stick to a schedule. We are creatures of routine. We do encourage people to get up the same time during the weekdays, even on the weekends. If you don't, you can have something called social jet lag, which is just like jet lag, and they can have, some untoward effects, right? You can feel sleepy, groggy, you can have headaches from, going through different time zones. Set a bedtime that's early enough to get at least 8 hours. I know 7 to 9 is recommended. We generally have a wake up alarm. I encourage my patients, gently remind yourself through setting a bedtime alarm as well. And don't go to bed until you're sleepy. Some of my patients have insomnia because their whole family goes to bed at 9, but their internal clock isn't quite ready to sleep until 11. So if you find yourself tossing and turning in bed, trying to go to sleep for an hour or two, are you really sleepy? Are you really tired? Is your body ready to go to sleep? Those are some questions to ask yourself. If you don't fall asleep after 20 minutes, get out of bed, have a relaxing bedtime routine, have a sleep ritual, have a wind down process, right? We do this pretty good for our kids. And then as adults, sometimes, we're working after dinner, we're on our phone checking emails, and then we're going to sleep and we're wondering why our brains aren't just magically shutting off. It's not a switch, it's more of a dial. And that's something I like to encourage my patients to think about. Exercise regularly. Get so physically tired, you have to go to sleep. Your body is almost forcing you to go to sleep. Caffeine, I'm sure everyone knows someone who can have an espresso and go to sleep. Caffeine can stick around 6 to 8 hours and even, 12 hours afterwards. So think about the last time you had caffeine. Maybe switch to herbal tea or decaf in the afternoon. Alcohol, we didn't talk too much about alcohol here, but alcohol can actually disrupt your sleep stages. It can decrease your REM sleep. And so I don't really recommend it too close to bedtime if you do drink alcohol. Fluid intake, right? If you're drinking sleepy time tea to help you relax and fall asleep, guess what? If your bladder is full, you may wake up to urinate. And then the last tip is always talk to your healthcare professional, talk to your doctor if you are having difficulty with sleep, right? Only 12% of us are doing it, and doctors don't always get around to talk to it as well. So if any of these things have come up for you, please talk to your doctor about it. You may have an undiagnosed sleep condition. Remember, sleep apnea is very common. 1 in 5 adults have it. So the last part of my talk today is a self check-in. So if you are having difficulty with sleeping, what is the root cause? Are you worried about your health? Do you have medications that you're taking? Are you short of breath? Are you snoring? What are your habits? Are you watching shows late at night because they're quite addicting? Do you need a CPAP machine to wear a mask? Do you have pain in your neck? Or are you having headaches, right? Or are you worried about something? Is there fear and anxiety that's keeping you from sleeping? All of these certainly can play a role. It's more than the physical. Sometimes it's, the mental aspect, the cognitive aspect that can play a role in your sleep. So just take a moment to maybe consider what's going on, because always the first step to behavior change is self-awareness. So taking the time to reflect on what's going on in your life and how that can play a role with your sleep. So in summary, sleep is vital for a healthy living. I do recommend, and most National Sleep Foundation, American Society of Sleep Medicine do recommend for adults try to get 7 to 9 hours. If you're not getting that, it may be associated with health problems, especially if it's 6 and less. High fiber diets are associated with better sleep quality as compared to diets high in saturated fats. Unfortunately, I don't know if anyone has this question, how much fiber? I looked at the nitty-gritty to the study. They didn't have the total fiber count listed. If you do have a sleep disorder that you suspect, talk to your physician about it. And, really bring to awareness, be mindful of what you're doing throughout the day. Are you getting enough sunshine? Are you exercising? Are you exercising too close to bedtime and your body's just too hot and it takes longer to cool down? Can you push that exercise to the morning and do it outside, right? Can you stack the habits together? Are you controlling your stress? Sometimes we're just really worried in general, and that can keep us from sleeping. So take a look at your lifestyle, take a look at your diet, take a look at your relationships, and think, how is that affecting my sleep? And then talk to those around you. And there's a great community that you're all already part of. And I'm sure that there's other folks that can help you as well.
Thank you so much for all of these tips, Dr. Val.
You're welcome.
Things for myself personally that I need to take a look at. And I know that other members have as well. I appreciate you very much for being here today. So for those of you who are with us and have more questions, or you want to learn more about how you can eat a diet that is associated with better sleep, if you're already a member, we'll see you in the Facebook community, in the private Facebook community. If you're not a member, then please go to fullplateliving.org and sign up. It is a free membership. You do have access to all of our programs, and you can get all of our resources. And Dr. Val also has some information over here about how we can reach out to her and get more sleep-related resources. Thank you for sharing that. That's important.
Yeah. Thank you for having me.
It was a pleasure having you here today.